Hello. I'd like to take just a moment and introduce myself. I'm Jack Easton, and I'm here today to moderate this Medicare education program. I'd like to welcome all of you. Perhaps you're new to Medicare, thinking about retirement. Maybe currently you're on an employer-sponsored plan, or maybe you just want to learn more about Medicare options. Well, I can guarantee you that you're in the right place. Before we move into the program, let me make sure that you're aware of a few things. The first thing is that we have the ability to mute your phones from our end, which means that you won't be able to ask questions. However, there is a chat feature that's available for you to jot your questions down and send them to us. At the end of the program, we've set aside time to address those questions. So if you happen to think of a question throughout the program, throw it into the chat. We'll take a look at it at the end of the program and respond to those questions so everyone can hear. Now, let's take just a little bit of time so that we can introduce you to the presenters of today's program.
Hello, I'm Jack Easton. Welcome to my office. Before this was my job, I spent a career in North Dakota helping people understand their insurance benefits. And here I am in retirement doing the same. This series is designed to help you understand your hard-earned Medicare benefits and how to get the most out of them. I'll be here to lend a hand and to facilitate the question and answers. I'm glad you've joined us.
Hi, I'm Mike Getzfried. As an insurance advisor, I help people understand their insurance coverage options. With Medicare, benefits come a la carte. Part A, Part B, prescription drug coverage, dental benefits, vision benefits, and the list goes on. Now, in North Dakota, we've developed a plan that wraps all those benefits up into one. It's called Medicare Advantage. We're going to dive deep into some of those details, and we're going to help you understand it better. So let's get started. Be sure to ask questions. I'm sure your neighbor or family may have the same questions as well. We're here to help, so let's go.
Hi, my name is Jim Nickel. My friends call me JD, so please call me JD. I've been helping North Dakotans and insurance professionals navigate Medicare for years, and I'd like to do the same for you, because boy, can it be confusing. We've got a lot of great information to share today, and a packed agenda as well. And that's really the philosophy behind Medicare Advantage plans, is that we take the original Medicare benefits and we pack it full of extra value-added benefits for you and make the whole thing go a lot further. We're about to break it all down for you so that you can be an informed Medicare consumer. So thank you for joining us today, and a warm welcome to you.
Hi, I'm Beth West, president of NextBlue. I've been learning a lot about North Dakota since relocating here. North Dakota nice, and the pride that people take here in the state of North Dakota. In fact, that's what's brought me here. The chance to lend my expertise to some really smart people to bring a new Medicare Advantage option to North Dakota. And so that's what we've done together with NextBlue. So stay tuned to learn more. Today our goal is to provide you information to give you the confidence in making your Medicare decisions. Grab a cup of coffee, a notebook, and let's get started.
Now that you've met the presenters, James Nickel, also known as JD from Blue Cross Blue Shield, Beth West, who is the president of NextBlue, and Michael Getzfried, who is an agent and consultant for Blue Cross Blue Shield of North Dakota. Let's talk a little bit about NextBlue. NextBlue is an affiliate of Blue Cross Blue Shield of North Dakota. It's the only North Dakota-based Medicare Advantage health insurance company. They focus on Medicare. They offer education, and they provide Medicare Advantage plans and options. They're available in 5 counties in the state of North Dakota and will be expanding in the future. The 5 counties currently being served are Burley, Cass, Morton, Richland, and Stutzman. Now, let's get into what will be covered today by our presenters. What is Medicare? Who is eligible and when? What are the key dates and helpful resources? What are my coverage options? So at this point, I'm going to turn it over to JD. So JD, take it away.
So the eligibility requirements for Medicare are the following. First of all, Medicare is a federal health insurance program administered by the Centers for Medicare and Medicaid. The first is adults age 65 and older and eligible to receive Social Security. Second, people under the age of 65 but are permanently disabled and have received Social Security disability benefits for at least 2 years. Third, people that have end-stage renal failure, kidney failure, or asymptomatic lateral sclerosis, ALS, also known as Lou Gehrig's disease. This makes them eligible for Part A, B, Part D for their prescriptions, or Part C, Medicare Advantage plans. It also makes you eligible for all of the rest of the Medicare products. Part C, or Medicare Advantage eligibility. So you need to reside in the United States. You need to live in the plan service area for at least 6 months out of the year. You need to be enrolled in Medicare Part A and Part B, and the beneficiary needs to continue to pay their Part B premium. That's very important. When can you enroll in Medicare? If you're turning 65, it's during a 7-month window, which is made up of 3 months prior to your 65th birthday, the birthday month itself, and then 3 months after the birthday month. So this graphic here does a nice job of explaining it. Your birthday month right in the middle, you've got 3 months prior, 3 months after. And you can enroll by going to www.ssa.gov/benefits/Medicare, or by calling the Social Security office at 1-800-772-1213. Can I enroll in Medicare while I'm still working? Well, that's a great question. If you're turning 65 currently and working, you want to consider the following 2 delineations, and it basically depends on whether your employer has 20 or fewer, 20 or more employees. So if your employer has 20 or more employees and you're in a group health plan, you may be able to delay enrollment in both Part A and B to avoid lifetime late enrollment penalties. You need to check with your employer's benefit manager to determine how the IRS defines your group health plan, though. The second is your employer has fewer than 20 employees. So what you'll need to do then is sign up for Medicare's Part A and B when you're initially eligible. The 3 months before your 65th birthday, your birth month, and the 3 months after. So in other words, right the previous slide, the description there when you turn 65. Otherwise, it's possible that you may have to pay a lifetime penalty on your Part B premium as well as a late penalty on your Part D for prescription drugs. And that's an enrollment penalty as well. And that's if, of course, you decide to enroll in those later or at some date in the future. You want to hit that 7-month window if your employer has 20 or fewer employees. If you have additional questions, please call us at 1-844-753-5678, or you can call Medicare at 1-800-MEDICARE, and that's 800-633-4227.
Hi, Mike Getzfried here. Let's dive in and talk about the options of Medicare and how they work. Option 1 is what's called Original Medicare. How this works is by offering coverage for services but broken into 2 different benefits, Part A and Part B. We'll talk more about how those work in just a bit. But first, let's look at Option 2, Supplemental Medical and/or Drug Coverage, also called Part D. Medicare does a great job in providing benefits to beneficiaries, but it doesn't pay 100% of everything. In fact, Medicare has never been designed to cover everything. That's why it's so important to look at supplemental coverages that we will discuss in more detail. So, As you can see in option 2, you have Part A and Part B as discussed in option 1, but you've also got supplemental coverage to pay for the benefits Medicare doesn't fully cover. And of course, the prescription drug coverage that is called Part D. And finally, option 3. This third option is called Medicare Advantage, or Part C. Again, as you can see, we have original Medicare with Part A and Part B, but this time we're partnering with other benefits called a Medicare Advantage plan. With a Medicare Advantage plan like NextBlue, we coordinate your benefits with original Medicare and can bundle many other benefits into one plan. Those benefits include prescription drug coverage, vision, dental, over-the-counter drugs, and what's called Silver Sneakers, just to name a few. Silver Sneakers is a health and fitness program that is specifically aimed at adults ages 65 and older. It allows beneficiaries to use participating gyms including fitness equipment, pools, and walking tracks. Okay, so let's break down Medicare in a bit more detail. Let's start with Medicare's Part A hospital coverage. An easy way to remember Part A is think A for admissions. This is how Medicare pays for your hospital benefits. Generally, there's no cost to the Medicare beneficiary for Part A. If you're admitted into the hospital, Medicare has a deductible, and that deductible is $1,408. Now, do you see where it says per benefit period? That benefit is every 60 days. So in other words, if you're released from the hospital and go back in 61 days later, even if it's for the same thing, you'd have that $1,408 deductible again. This is why it's so important to purchase a supplemental product to help protect you from these exposures. As we've said before, Medicare does a good job in benefits, but it doesn't pay for everything at 100%. For example, if you've been in the hospital for over 60 days, Medicare still offers benefits, but they start to draw back how much they'll pay per day. In other words, you could end up paying $352 per day unless you had supplemental benefits to protect yourself. And if you're in the hospital for more than 90 days, Medicare draws back its benefits even further to $704 per day, as you can see in this slide. Skilled nursing coverage is an important one. Now, Medicare doesn't provide long-term care insurance, but they do provide coverage if you're in need of a skilled nursing facility during your recovery from an illness or injury. And as you can see, Medicare does a good job of providing benefits during your recovery, but doesn't pay for everything. In addition, you can see that there are some other Medicare Part A benefits, such as home health care and hospice. Medicare Part B is the physician coverage. Here's where you'll find your benefits that are not related to hospital services. For example, doctor visits, outpatient services, laboratory services, chiropractic services, and preventive services, to name a few. Screenings and immunizations are also covered under Part B, including the COVID-19 testing. Here's how it works. Medicare does charge a premium for Part B coverage, and that premium can range from $144.60 to $491.60 per month. This variation is determined by the beneficiary's income and is determined by Medicare and is revised periodically. Part B benefits also include an annual deductible of $198. Once that deductible is satisfied, Medicare pays 80% of most services, leaving your responsibility at just 20%. Now, on to Medicare Part D, prescription drug coverage. Original Medicare does not provide prescription drug coverage for medications that you buy at your pharmacy. Therefore, a prescription drug plan is so important to purchase in addition to a supplemental product. Medicare Part D plans are offered by private and Medicare-approved insurers that help cover your prescriptions. On a prescription drug coverage plan, you would have a deductible that would not exceed more than $445. During that initial coverage, you have benefits to protect you up to $4,130. And in that time, you may be paying just a simple copay, or you may be paying some coinsurance, which by its definition is a shared cost between the insurance plan and yourself. Now, once the retail cost of medications meets that $4,130, you enter the coverage gap. This is also commonly called the donut hole. During that time, you are paying more for your medications and the plan is paying less. Once you've satisfied a $6,550 out-of-pocket, you come out of the coverage gap or the donut hole, and you enter what's called catastrophic coverage. At that point, your medication costs are reduced significantly. It's important to understand that Medicare Part D prescription drug plans do not include over-the-counter medications. They vary in benefits from plan to plan, and they require you to use network pharmacies. Not only is it important to have a prescription drug plan, but it's also required by law when you first become eligible for Medicare. What I mean is this. You may be penalized for not enrolling when you are first eligible and don't have other credible prescription drug coverage, or if you've had a break in coverage for at least 63 consecutive days. How much is the Part D penalty? Well, the cost of late enrollment penalty depends on how long you went without a Part D or credible prescription drug coverage. Medicare calculates that penalty by multiplying 1% of the national base premium, which is $32.74 in 2020, and the number of uncovered months you didn't have Part D or credible drug coverage. The monthly premium is rounded to the nearest 10 cents and added to your monthly Part D premium. The national base beneficiary premium may change each year, so the penalty amount may also change every year. Let's talk about Medicare supplement plans. These plans help bridge the gap between what Medicare covers and the total cost of medical services. That's why they're also called Medigap policies. They cover a portion of Medicare's deductibles and coinsurances, they coordinate benefits with original Medicare, and they are federally standardized. That means Medicare supplement plans from company to company must be identical in benefits. Medicare is in the primary position of your insurance, and any supplement is secondary or supplemental. This means if Medicare does not approve a service, the supplement is not allowed to pay for that service either. Medigap plans do not provide prescription drug coverage. That must be purchased separately. Also, you may not be eligible for Medicare supplement if you do not enroll when you first became eligible for Medicare.
Thanks, Mike. Now we will talk about Medicare Part C, also known as Medicare Advantage. Medicare Advantage plans are offered by companies that contract with the Centers for Medicare and Medicaid Services, otherwise known as CMS. Medicare Advantage plans are another way to receive your Medicare benefits. Medicare Advantage plans combine your Medicare Parts A and B coverage and many times include your Part D, your prescription drug coverage, into one convenient plan. These plans also offer additional benefits not covered under original Medicare. Examples of these types of extra benefits are listed here. Coverages for things such as routine vision and eyewear, dental services, hearing aid evaluations and hearing aid devices, fitness programs, over-the-counter medications and supplies, as well as urgent and emergent coverage for when you travel worldwide. In addition, these plans typically have low cost shares and have the extra security of an annual maximum out-of-pocket limit. These Medicare Advantage plans are a great alternative to original Medicare. So now we'll look a little deeper at Medicare Advantage. Medicare beneficiaries may choose to buy a complete package with the Medicare Advantage plans. So let's break it down. First, you have your original Medicare Part A coverage. This is coverage related to hospital care, skilled nursing, hospice, and home health. Then you have your Part B coverage, B as in boy. This is your original Medicare coverage for services such as doctor's visits, mental health care, outpatient surgery, lab tests, and durable medical equipment. Then we'll jump over to the far right and you'll see that we have the Part D, your prescription drug coverage. And then with Medicare Advantage, you add in other benefits, like we talked about a moment ago. Things such as dental, vision, hearing, preventative care services, and other supplemental benefits. When you roll all of these components together, that is what makes a Medicare Advantage plan, otherwise known as Part C coverage. For those of us who are visual learners, or those of us who like lists, here is a summary chart showing the different options you have as a Medicare beneficiary and the ways you receive your Medicare benefits. So we'll start to the left with Original Medicare. Under Original Medicare, your Parts A and B, you basically have coverage for all of your medical needs, your care that you receive in a hospital or by physicians. Your second option is to take your original Medicare and purchase a Part D prescription drug plan to go along with your original Medicare coverage. Your third option is to take original Medicare, purchase a Part D prescription drug plan, and purchase a Medigap or a Medicare supplement plan to add additional coverage. And then you have your fourth option, Medicare Advantage. Most Medicare Advantage plans cover Part D in the plan itself, so you don't have to purchase your Part D coverage separately. However, you do need to check that just to make sure. In addition, you can see as you look across the summary chart that as you move from left to right, you have additional added benefits. As we've discussed, the Medicare Advantage plans many times have these extra benefits, things such as dental, vision, hearing, fitness programs, care outside of the U.S., things such as this. At a minimum, a Medicare Advantage plan covers all the services covered by original Medicare, but many times offer additional coverage beyond what original Medicare does. As we wrap up, I'd like to remind you of some key enrollment periods. These are dates in which you need to remember. First, we have the annual election period, otherwise known as AEP. This runs from October 15th through December 7th. During this period, you can join, drop, or switch Medicare Advantage plans, or you can choose to enroll in a Medigap or Medicare supplement plan and purchase a Part D plan, or have original Medicare with or without a Part D. Then you have the open enrollment period, or OPE. This occurs from January 1st through March 31st of each year. During this time, if you're enrolled in a Medicare Advantage plan, you can leave your plan and go back to original Medicare and buy a Part D plan to supplement your original Medicare, or you can switch to a different Medicare Advantage plan. Then you have what is called a special enrollment period, or SEP. If you have a life qualifying event like losing your health care coverage or moving out of the plan service area, you may qualify for a special enrollment period and sign up for a Medicare Advantage plan. You will likely have a 60-day window before the event happens through a 60-day window following the event to enroll in a plan. However, if you miss your SEP, you may have to wait until the next open enrollment period to apply. I hope that this information has been helpful.
Well, that was a lot of great information. I want to thank our presenters for today, and I also want to thank you for taking the time to join us. You'll see on the screen right now is additional helpful resources. There was a lot of information shared today, and I'm sure you're going to have additional questions even after we're done with our Q&A. So don't hesitate to tap into the resources listed. Now, thank you for those of you who have sent questions in on our chat feature. Why don't we get started with those right now and see if we can field the questions and the answers.
All right, our first question is for JD. Why don't we give this to you? Why is my mailbox so full of Medicare information and companies asking to meet with me?
Well, Jack, it's a great question. Every year from October 15th through December 7th is the Medicare Advantage annual enrollment period. Medicare Advantage companies are competing for your attention and hoping you will enroll with them. Insurance companies know that typically once you enroll, most people tend to stay with that company. And it's very scary to start out a whole new style of health insurance, and change can be scary. One way to overcome this concern is to work with an insurance company that you know and trust in your community.
Okay, let's go on to the next question. Mike, why don't we give this one to you? What if I go south for the winter?
Well, thanks, Jack. That's a question that we get asked an awful lot. What you want to do is make sure that your plan allows you access to providers outside of your service area, and then make sure that provider is in the network to ensure you'll receive your in-network benefits.
Okay. All right, so JD, can I still go to my doctor?
Yes, If your doctors are in the plan network of providers, you will receive your best benefits and generally pay the lowest cost share. If your doctor is not in the plan's network and the plan that you selected allows you to access to out-of-network providers, you can still see your physician. And in some cases, that plan may not charge you more to see someone out of your network. However, an out-of-network provider is not required to see you.
So, Mike, I want to throw this one back at you. Why is this all so confusing?
Well, it sure can seem confusing, Jack. That's why you should call us and you should meet with us. We can explain all your options and what might work best for you. You probably receive many letters and packets in the mail. Just bring them in and we'll go through it and show you what we think is important to keep or what you should discard.
Oh, well, that makes it easy. All right, so JD, what happens if the government makes changes?
Currently, over 1/3 of Medicare beneficiaries are enrolled in a Medicare Advantage plan. They're very popular due to the value that they provide. Medicare Advantage plans must comply with federal regulations. Should changes to your plan be required by the federal government, you will be notified. However, Medicare Advantage plans benefits generally don't change during the plan year.
All right, everyone. JD and Mike, I want to thank you guys for fielding the questions and giving us some more insight. It is very confusing, and you guys make it so simple. So thank you all.